Hello everyone and welcome to today's webinar by Qualistory. My name is Jan and I will be your main moderator for today. And today's session is fascinating and is titled How to Make Risk-Based Decisions to Meet Production Needs and Compliance. And it will be presented to you by Simon Ammons. And in this webinar, you will learn how to use risk-based decisions to meet production needs while remaining compliant. At Qualistory, we aim to empower pharmaceutical companies with freely accessible education and skills to manufacture high-quality medicine while connecting you to innovative industry solution, and we managed to do it with the help of our incredible partners and sponsors. And for this webinar, our partner is QNAP, and I want to thank them for doing this event with us. So if you've never heard about them, they're a new and emerging company. They're a startup, and it's always amazing to see new solutions pop up and help us to manufacture better medicine. And a bit about QNAP. So QNAP is innovative data-centric software solution designed to minimize equipment downtime by providing immediate access to vital data. The concept of QNAP was conceived by a seasoned process engineer who, like many in the field, faced the frustration of not consistently having access to necessary process equipment data in a timely manner. And QNAP facilitates immediate access to vital equipment data using just your phone or camera-enabled device, thereby ensuring uninterrupted production and empowering your team. And now I'm eager to introduce to you the speaker at today's webinar, Simon Ammons. So Simon brings extensive expertise as a process engineer with a career spanning over 15 years. She has an impressive track record, having worked in the oil and gas, chemicals, and pharmaceutical sectors for renowned companies like GSK, BASF, DuPont, Dow Chemicals, etc. Simon's experience includes leading equipment design, procurement, installation, and commissioning, encompassing a diverse range of systems from heat exchangers to bioreactors. And notably, Simon also excels in developing commission protocols and SOPs for complex systems while emphasizing effective communication with key stakeholders. And she holds a BC in chemical engineering and MSc in biomedical engineering that helps her throughout her career. So without further ado, I'm sure you can learn much from Simon today. So Simon, the stage is yours. Happy learning, everybody.
Thank you, Jan, for this wonderful introduction. So we'll jump right in. For today's agenda, we'll be diving deeper into what is risk. But before we dive into risk decision making, we need to understand first what it is. What is risk? We also need to understand the risks that are within our control and the ones that are not. We'll also learn why it's important to understand risk and the steps that we can to manage, mitigate, and lower our risks, especially when it comes to pharmaceutical manufacturing. Let's all remember at the end of the day, it's the patient's lives that's at stake. Keeping production happy means we're keeping our patients happy. They get the drugs and the therapies that they need on time and without any complications. The neat thing is because all decisions are made on risk, you not only keep production happy, but you also keep your patients happy as well. But now, moreover, you've remained in compliance as well. So it's just a win-win-win situation. So like I said, we're going to go into the details of what is risk. Then we're going to talk about the risks that we can control. We're going to talk about the risks that are outside of your control and what we can do about those. We want to understand why we need to understand risk, why manage risk, how you can leverage risk, how you're keeping production happy, and then remaining in compliance. All right, let's dive in. What is risk? Can we see any comments in the chat? What do you think risk is? The chance of a failure mode occurring, harm on the patient. Love it, love it. Okay, so my screen is, here we go. All right, at the end of the day, it's the patient, right? all risk laid back to the patient. That's why we're here. That's why we do everything we do day in and day out. The sanctity and preservation of human life is the ultimate goal. It should put things in perspective. So when we think about risk, there's a couple questions we need to keep in mind. One of them is, what could go wrong? Another question we need to keep in mind is, how can we respond when things actually go wrong? And then lastly, we look at, how do we prevent things from going wrong in the first place? These are the three aspects that we're going to talk about today. I like to also bring your attention to 1982, when there were several deaths linked to a drug tampering in the Chicago area in the US. The Tylenol capsules have been listed with cyanide, and some patients who actually took that cyanide-laced Tylenol died within 24 hours. Although tragic, this leads to reforms in packaging and the tamper evidence seals that we see today. So what was the risk? As our questions, what went wrong? There was no sealing in place at the time of manufacture to secure the contents of the pill bottles. How did they respond? The Tylenol maker, Johnson & Johnson, halted production, and advertising of Tylenol in the US was actually praised for their swift and transparent response to the ongoing incidents. How did they prevent this from going wrong again? The FDA, which is the Food and Drug Administration in the US, implemented tamper-evident packaging. So that's how, in a very tragic incident back in the 80s, a company actually addressed risk and actually got better, not just for the company, but industry-wide, when it successfully managed risk. So in this picture, what risk do you see? Okay, let's go. Number one. In the event of a power failure, are there any backup emergency lights that automatically come on if we lost power? And with all of climate change going on, we've seen a resurgence of devastating storms and outages. Are you ready if a power outage was to occur in a facility today? How about the penetration in the ceiling? This looks like an aseptic area. How intact is that seal to keep contaminants out of this room? Another issue I see, the HEPA filters. Are they HEPA filters? Are they the appropriate filters for that room? When was the last time these HEPA filters were replaced? What is your PM management strategy, your preventative maintenance, to make sure that those filters are actually up to specification? Here's another penetration in the ceiling. Same concern. Now there are, instead of 1, 2 places that you could potentially have contamination coming through into an aseptic room.